Great, thank you. We have, next is Constantino Betsis, then Matias Marin, and the last speaker is Adolfo Gonzalez.
You want to come with me, eh? Okay. Good afternoon, respected members of the Board of Health. I am a 47-year-old retired professional who is a medical marijuana patient. However, I am not here with my 75-year-old mom and my service dog to talk about the medical aspect of your considerations. Although I do significantly echo the remarks made by Chris, it is offensive to me that I have been brushed aside as a medical patient so that the City of Toronto can begin to determine how many dollars are going to come from the eggs that they have counted. Enough is enough. You had a 25-page report that was buried as a reference in today's agenda items. Those 25 pages were reviewed by a blind man over the course of 5 days and have 82 pages of notes with them. The City of Toronto has made it clear in their report that they did not take care to examine all of their facts. In fact, more than 30% of the facts in the report are completely inaccurate, and as a Toronto citizen, I'm ashamed that the City of Toronto has proposed some of the "we're the second city in the world." We have data and scientific information. This report was written well after Justice Phelan's clear decision that medical marijuana patients must be put ahead of all other issues. Interestingly enough, again with the report, the City of Toronto seems to lean on the very evidence Justice Phelan mocked and clearly stated was not only inaccurate, but was offensive. The bias from the very witnesses from the federal government's perspective was so clear that it was laughed at. We sit here with an opportunity to try and ensure that we do the right thing. We sit here with an opportunity to be able to open up two-way discussion that is new and fresh. I am not naive enough to think that all of these dispensaries are real. They're not. A good proportion of them are nothing short of criminal enterprises. Compassion? It is 50 cents to $1.50, $2 tops, unless you're one of the political cronies that's got an LP. How does a dispensary or a compassion club have the audacity to tell me that God's vagina is $530 for an ounce? That's affordable? Seriously. The City of Toronto has to take action, and that action must and will include citizens, not just of the city, but of Canada. I was not consulted, and based on everything I've seen, the only people that were consulted by this Board of Health either paid for it through lunches or made sure that they presented themselves as the end-all, be-all, de facto rulers of what our medical and our recreational system will look like. Congratulations to the LPs for being out there and making their profits. But we, as medical patients and as citizens, will be heard. Thank you.
Thank you. Next is Matias Marin,